This is Morgan Lundquist reporting for Worldwide News. Tonight we will be discussing a current issue affecting many college women. According to South Carolina Department of Mental Health, around 8 million Americans, 7 million women, and 1 million men have eating disorders. Eating disorders are also a major problem with college students, with the most common age being 15 to 24 years old. There are many different kinds of eating disorders, but the two most common are anorexia nervosa and bulimia nervosa. Anorexia nervosa is when someone restricts their eating habits to a point where they become 15% or more below the normal weight. Bulimia nervosa involves binge eating and purging, which is when someone eats a lot of food in a short amount of time and then rids him or herself of the food by vomiting or spitting up the food.
Genetics, social pressure, anxiety, and depression are all known causes of eating disorders. We know that the rise in eating disorders among young college girls is problematic because over 1/2 of teenage girls use unhealthy weight control behaviors, and 25% of college-age women take part in binging and purging as a part of weight management. Eating disorders have the top mortality rate of all mental illnesses. The struggles that a woman goes through to fulfill the ideal of a stereotypical woman is one of the causes that develop of an eating disorder. Many women do not realize that their eating disorders are even a problem because behavior has become normal to them. Another factor in the development of eating disorders is control. Women may feel that their lives are out of control, and their weight is one thing that they can exert control over. Eating disorders have been a problem for a long time because college girls are expected to look the part, and that puts a lot of pressure on them.
We then looked at solutions for the problem of eating disorders and determined criteria to evaluate the potential solutions. These criteria were: Criterion 1, solution must educate people on the importance of eating healthy. Criterion 2, solution must have the potential of long-lasting effects that can assist generations to come to reduce the number of people who have eating disorders. Criterion 3, the solution must be something that campus administrators will find acceptable because we are trying to address the prevalence of college-age women who have eating disorders. Criterion 4, solution must incorporate people who have eating disorders to make people with these eating disorders not feel alone with the struggle. The solution should help people feel free of judgment.
So she's going to do that.
The solution that we felt best fit the criteria was to create an organization on campus that has weekly meetings for people with eating disorders or people who know someone who has an eating disorder. This organization could also educate people on campus about eating disorders by facilitating panel discussions in classes, residence halls, and other university settings. People in the panels could talk about their personal stories and provide education about healthy eating habits and the resources on campus for people struggling with an eating disorder. This organization could also provide training sessions for students, staff, and faculty to help them understand eating disorders.
This solution meets the first criterion because it educates women and others through the discussion panels about eating disorders and how important it is to eat healthy. The second criterion is met because the panel discussions and weekly meetings have the potential for long-lasting effects since they can continually educate new college students about eating disorders and help reduce their prevalence on college campuses. The solution meets the third criterion because campus administrators will find the solution acceptable, because it is not uncommon to have organizations on campus that can provide panel discussions and weekly meetings. Lastly, the solution meets the fourth criterion because people on the panels will talk about their experience with eating disorders and help audience members not feel alone in their struggle if they have an eating disorder themselves. Also, people who have eating disorders or have had them in the past and are willing to speak about their experiences need to be found so they can be part of the weekly meetings and panel discussion. Additionally, a faculty advisor and a location for the meetings needs to be determined. Furthermore, it's important to bring awareness to this organization on campus to make it successful. To bring awareness, a website could be created as well as posters could be put up around campus. Also, people from the organization can set up tables with information about it outside of the student center, and members could go around to health classes to further bring awareness. The prevalence of eating disorders will be reduced on college campuses, and a forum for discussion will be created, so greater awareness will be brought to this issue. Thank you for tuning in tonight for our newscast about eating disorders in college-aged women. We hope we have provided you with some valuable information about this issue. Thank you. This is Katie Hutter signing off. Have a good night.